Bismillahirrahmanirrahim. I welcome you to the neuroanatomy lecture. We have started cranial nerves and we were doing trigeminal nerve. In my first lecture of trigeminal nerve, we have completed trigeminal ganglion, its formation and its branches. Now we come to the first branch of that emerged from the trigeminal ganglion, and it traveled towards the cavernous sinus. Um, in learning outcomes, by the end of this lecture, you will be able to know what is ophthalmic division, its course, branches and distribution to different structures, and in the end we will discuss about some clinical correlations of this nerve. Here you can see the we are doing first division of trigeminal nerve, that is ophthalmic division of trigeminal, and here in this figure it has been shown in green color. We can see there are some branches that are shown in this picture. Firstly, you can see the frontal nerve, then you can see nasociliary nerve, the lacrimal nerve. They are all obvious on your screens. Now we come to the pathway of this nerve. This nerve emerges from the trigeminal ganglion, as I told you earlier. Then it travels within the lateral wall of the cavernous sinus, and uh, it gives three branches in anterior part of the cavernous sinus. These branches are lacrimal, nasociliary and frontal that I have shown you previously. I will show another picture in the next slide. Then they travel towards the superior orbital fissure and they reach the orbit. Here you can see, if you can follow my pointer, the nerve is arising from the brain stem. It leaves the brain stem at the level of the pons. Then its sensory root swells and form trigeminal ganglion. From this trigeminal ganglion, you can see the upper one is the ophthalmic division of trigeminal nerve, and it is going into the cavernous sinus, and from the cavernous sinus, where it divides into three branches, and from the cavernous sinus it traveled toward the superior orbital fissure, and from there it entered into the orbit. In the orbit you can see here the frontal nerve, the lacrimal nerve and the nasociliary nerve. They all are present in line on the top of the figure. Here you can see them all very clearly. Then we come to the first nerve, that is the lacrimal nerve. This is a small nerve. It passes into the orbit through lateral compartment of the superior orbital fissure outside the tendinous ring, and it also receives communicating branch from trochlear nerve branch of then it also receives some branch from zygomaticotemporal, that is the branch of maxillary nerve. We are discussing this lacrimal nerve. It receives two branches, one from trochlear nerve and other from zygomaticotemporal, that is a branch of maxillary nerve, and it supplies sensations to the lateral part of conjunctiva, upper eyelid, lacrimal gland, and it also gave postsynaptic parasympathetic fibers from pterygopalatine ganglion to the lacrimal gland. Now I will show you here. You can see this is the lacrimal nerve lateral compartment. It is reaching the orbit through lateral compartment. Then we come to the frontal nerve. Frontal nerve is the largest cranial nerve of largest division of this nerve. It enters the orbit through lateral part of the superior orbital fissure outside the tendinous ring. That is also present outside the tendinous ring, and it passes forwards between the roof of the orbit and levator palpebrae superioris muscle. And it divides into two branches that are the supratrochlear and supraorbital. This is the supraorbital and this is the supratrochlear. The supratrochlear is the smallest nerve, medial branch. You can see it is present medial to the supraorbital nerve. It receives communicating branches from the infratrochlear nerve also, and it curves around the supromedial margin of the orbit, medial side and superior margin, and it supplies um, here you can see median conjunctiva, upper lid, lower part of the forehead, and lies between the frontalis and corrugator supercilii muscles. Here you can see this is the frontalis muscle and this is the corrugator. The pointer is moving here. You can appreciate the presence of these two muscles. Then the supraorbital branch that is present just lateral to supratrochlear nerve. It passes through supraorbital notch and divides into medial and lateral branches. Here you can see it has been divided into branches, and it supplies here. It lies beneath the frontalis muscle and supplies the conjunctiva, scalp up to the vertex, superior most part of the scalp, and then mucous membrane of the frontal air sinuses. Here you can see those 5 branches. The first one is the short ciliary. You can see here the laser pointer. This is just above the ciliary ganglion. The short ciliary nerves. These fibers contain fibers from the ciliary ganglion. Then on the right side of this figure, the lowermost red arrow, and you can see close to the laser pointer, you can appreciate the presence of the long ciliary nerve. Long ciliary nerve are 2 or 3 in number and they supply the iris and cornea. Then above the long ciliary nerve, you can see here the posterior ethmoidal nerve. This passes through the posterior ethmoidal foramina to supply the ethmoidal and sphenoidal air sinuses. Above the posterior ethmoidal nerve, you can appreciate infratrochlear nerve. It appears on the face above and medial to the angle of the eye, and it supplies the lacrimal sac and caruncle. Then we come to its fifth last branch, that is the anterior ethmoidal nerve. This is the larger terminal branch and it passes through anterior ethmoidal foramen, travel within the canal and into the anterior, that is in the anterior cranial fossa through slit lateral to crista galli and it enters into the nasal cavity. Within the nasal cavity, it divides into two branches: medial and internal nasal branch that supplies the anterior part of the nasal septum, and lateral nasal branch that supplies the anterior part, anterior and lateral part of the nasal cavity, and emerges as external nasal nerve to the skin of ala, vestibule, and tip of the nose. Here, all the branches have been shown that you can see. We can follow them from A to G. A is the infratrochlear nerve. Here, then B, this is the B is anterior ethmoidal nerve. C is posterior ethmoidal nerve. D is the lacrimal nerve that travel laterally. Then supraorbital nerve present laterally. Supratrochlear nerve that is shown in F. It is present medially. Then nasociliary that is present on the medial side of the orbit. These are the branches that can be seen on the face. Ophthalmic deviation of trigeminal nerve, it is sensory to this much part of the face and scalp. Here you can see all its branches are shown. This is the lacrimal nerve. These are the external nasal branches. These are supratrochlear and supraorbital branches. All are visible on this figure. Now we come to its clinical aspects. Ophthalmic deviation of trigeminal nerve, if it is damaged, the corneal reflex will be absent and there will be no blinking even in response to vigorous poking of the eye. Last aspect but not the least, that is the neuralgia. This is known as trigeminal neuralgia, involving the first division of trigeminal nerve, that is the ophthalmic division. That is not so common, but in case if the trigeminal nerve gets compressed or it is damaged at any level, at the level of its ganglion or at the level of when it gives ophthalmic division, this neuralgia can be the result. In this case, how can we differentiate neuralgia from typical pain? In case of neuralgia, you will have some trigger zones on the area that is supplied by a specific nerve. In this figure, the green area is supplied by the ophthalmic nerve. If the ophthalmic nerve has been compressed intracranially at any level, if on the face you touch any area that is supplied by any branch of this nerve, the pain will result. How can you differentiate a normal pain from the neuralgic pain? In case of neuralgic pain, there is tearing and excruciating pain, and that is not relieved by simple painkillers. For relieve to stop the pain or to give comfort to the patient, you have to give centrally acting painkillers to the patient. With this, we come to the end of our lecture. Thank you for your attention. Allah Hafiz.